Okay, so this is the flow chart that our group came up with to outline the current discharge process being experienced on the floor. So the discharge process really begins once the provider puts in the discharge order in the EMR system. Once that order is placed, the nurse then needs to consider if the MedRec has been completed by the provider. If not, then the nurse will contact the provider and request the MedRec completion. If it's already been completed, then the nurse will move on to completing a core measure sheet. And the core measure sheet is just really a tool to help ensure that patients with certain diagnoses like diabetes or congestive heart failure are being discharged with appropriate evidence-based medicine on board prior to discharge, and that any follow-up appointments that are necessary are scheduled prior to discharge. So once the core measure sheet is completed, the nurse will then decide if the patient or caregiver needs a translator service in order to receive the discharge information and instructions. If so, the nurse will then go grab the hospital approved translator service and then will proceed to head into the patient's room to give the discharge paperwork and instructions to both the patient and or caregiver. And then once the nurse completes the discharge information and instructions, the nurse will ask if the patient and or caregiver have any questions or concerns regarding the information that she or he provided to them. If there's any questions or concerns, the nurse will then address any concerns and questions. And once the patient and caregiver verbalize that they are comfortable with all the discharge information and have no further questions or concerns, the nurse will then have the patient sign the discharge paperwork, and the patient is free to leave the hospital. So that is the current process for discharging a patient. Thank you.